Top Med Talk.
Welcome to Top Med Talk. I'm Desiree Chappell. Now today we have a very special guest joining us from the Anesthesia Patient Safety Foundation. But first, let's catch up with our editor-in-chief joining us from London, England, Monty Mythen. Hello, Monty.
Hey, Desiree. How are you?
I'm doing okay. Now, Monty, very special guest with us today. He's joining us from Chicago, Illinois in the U.S. It's Dr. Stephen Greenberg. Hello, Stephen. How are you?
Hey, Desiree, how are you? I'm so glad to be a part of this Top Med Talk and appreciate the time that you're taking.
Yeah, absolutely. Well, we appreciate you. Now, Stephen, you are the editor-in-chief for the Anesthesia Patient Safety Foundation newsletter. And can you tell us a little bit more about that and a little bit more about your background?
Yes, absolutely. Well, just sort of for full disclosure, I want to give you a little bit about my background. I'm an anesthesiologist. I've been practicing for 15 years at NorthShore University HealthSystems in the north side of Chicago. And I'm also an intensive care physician and run our Evanston ICU in our organization. So that's my background. I've also been in the Anesthesia Patient Safety Foundation since 2007. And, it's really interesting. Really, the giants of our field in perioperative patient safety have really started this organization, whether it was the likes of Dr. John Eichhorn, Jeff Cooper, who's been incredibly involved with patient safety and simulation, and E.C. Pierce, who is one of our original organizers. The APSF has a tremendous amount of history as it relates to improving patient safety in perioperative and particularly anesthesia-related care. So I've been really lucky to be a part of the organization, and about 4 years back, I assumed the position as editor-in-chief of our Anesthesia Patient Safety newsletter, which at the time had a circulation in the United States of around 120,000 anesthesia professionals. We are a multi-professional, multidisciplinary organization. What that means is that folks that deliver perioperative care are welcome to join us, and that is all folks that deliver anesthesia, folks that are involved in risk management, industry, healthcare administrators, nurses, and anyone else who is involved with that type of care. So it's really an incredible organization because it speaks to how we deliver care, safe care as a team. So going back to the APSF newsletter, since taking over as editor-in-chief, we have developed substantial relationships not only in the United States, but outside of the United States. It's interesting, about 5 years back, I was at a meeting in Japan, and one of the leaders of the meeting said, I really like the APSF newsletter. Is there any way that I could write an article about the Japanese culture of anesthesia? I said, absolutely. And because of that, we decided that would be the right thing to do would be to start translating the APSF newsletter in Japanese. And that built more relationships with the Japanese Society of Anesthesiology. And we now have a Japanese newsletter customized to their constituency. And from that, we developed relationships with folks in China, in France, all over South America and Spain. And now we are in over 5 different languages translating our APSF newsletter. And as I was telling you, Desiree, we have now over 1 million visitors worldwide on our website as it relates to the newsletter. And just to give you that huge uptick, there was about 3,000% increase since 2016. And so we've really taken off. And as I told you, about at least one of our pages or articles have been read by almost everybody everyone in every country in the world. So it's been really exciting, and particularly during this time of the pandemic. One of the articles that we put out in February was the perioperative considerations for COVID-19 has had over 600,000 unique visitors to it. And it really set the standard in the United States on how providers should protect themselves when they're dealing with these patients, either in the operating room, in the intensive care unit, or anywhere. and particularly as it relates to aerosolized procedures. So with that, we've also partnered with the American Society of Anesthesiology to help them with providing guidance on PPE, perioperative testing, and the like. So, our organization really partners with other organizations to try to develop recommendations for best safe care. And so it's really been exciting to be on the lines of, providing education and outreach for other local and national, international leaders in patient safety.
That's excellent. Now, there are some initiatives that that you said you were working on through the APSF. Can you just highlight a couple of those for us?
Yeah, so back in 2018, our multidisciplinary, multi-professional board actually voted, sort of used a Delphi technique and sort of compared a bunch of different overall perioperative care safety initiatives. And we voted on the top 12 to say, what are we going to do in the next 3 to 5 years in terms of not only education, but providing some research funding and outreach and partnership with other large organizations in terms of focusing on making change to help patients be safer during perioperative care. And highlights of those patient safety initiatives would be focused on our yearly meeting, which is named after our past president, Bob Stolting. It's the Stolting Conference, and it occurs in Arizona once a year. This year, we're probably going to do it virtual, or we're going to sit out a year. But it's been going on for over 10 years. And last year, we focused on preventing, detecting, and mitigating clinical deterioration in the perioperative period. And so a focus group of, industry providers, anesthesiologists, nurse anesthetists, anesthesiology assistants, risk managers, nurses, administrators, all got together and tried to develop ideas that could help reduce the risk of patients deteriorating without being detected and without being appropriately managed. That's one of our top safety initiatives. The other initiatives that we're focusing on are safe care of patients outside of the operating room, things like medication safety, the culture of safety in terms of improving teamwork. We're also looking at professional provider burnout, which is really a significant problem in the United States and beyond. Actually, the South Americans that are partnering with us were very interested in the articles that we've released in the last couple of years about professional burnout and what kind of ways we can reduce the risk of burnout. And burnout might lead to substance abuse, which is really an important thing to avoid. So we've really dove into that kind of stuff. We've also developed a multi-center international handoff collaborative. As folks know, both in and outside of the operating room, transitions of care are really important, and communication is so important to the safety of our patients. So that's another thing that we're focusing on. Cognitive dysfunction and brain health. We're partnering with the ASA to help try to figure out ways that we can reduce the risk of patients developing delirium and cognitive dysfunction throughout the perioperative process. Airway management and cost effectiveness of protocols and monitoring. And so we bring these, and I'm happy to say that the Anesthesia Patient Safety Foundation newsletter has really touched on all of these topics in the last 2 years in our articles. So tune into the newsletter and you'll see those topics heavily addressed in the last few years in our newsletter.
So congratulations on all the fantastic work. And in particular, I'd just like to highlight that translating into multiple languages, which obviously has a huge impact. But that's the translation of the words that have been spoken and written down. How do you manage to effectively translate into different healthcare economies, which is always one of the big challenges? We get together in our very well-resourced world and we say, here's what we think good looks like. And other people turn around and says, yeah, but we don't have even the most basic monitor, for example. How do we manage to achieve that?
That's a fantastic question. I think that it starts with reaching out to, those folks and saying, what do you need and how can we partner with you to achieve it? I think the first step is translation, as you said. It's building relationships. If you don't have the relationships with people, they won't read anything, or they won't, you can't even get to the technology part. So I think you need to reach out to people that don't have the resources that you might have and say, what safety topics, what things are really concerning you? For instance, in Columbia, they were really concerned about professional and provider burnout. And that was something we had touched on in the last year significantly. There are things that are required in terms of resources to try to reduce the risk of that, but it might not involve high-level technology. It might require awareness. It might require a reduction in how we deliver healthcare in terms of hours, or being more unique in terms of giving our providers a more balanced work-life balance. So I think there are things that concern others that might not even need technologically based solutions. I think that's what we've been trying to do, is engage folks internationally to join our editorial board and to join some of our initiatives to say, how do we accomplish these, as you just said, in areas where we don't have the high level early warning systems integrated into our electronic medical records? When you really just need to have oxygen tanks, where do we come, sort of how can we help you do the things that might not need all that high level technology? It's interesting, that one thing we've learned is that people's concerns are different around the world. Some of them are the same, but a lot of them are different. And yet, by engaging folks and bringing them together, we might be able to solve solutions together.
And if I may, Desiree, one more follow-up there. I can understand historically why it's the official journal of the Anesthesia Patient Safety Foundation. Have you had any discussions about feeling constrained by the term anesthesia? Because to some people, that means the provision of, let's call it sleep, for argument's sake, to enable surgery. But now we're thinking of it so much bigger.
Yeah.
Yeah, that's
that.
Fantastic question. One that our board has grappled with pretty much every time we get together, which is 2 or 3 times a year. And that is, we want to think, and particularly, our executive members and our board, we want to think a little larger than the word anesthesia. In fact, we recently changed our vision statement to "No one shall be harmed by anesthesia care." And hopefully that means any anesthesia professional, and many of us don't just work in the operating room. We work in preoperative testing areas. We work inside the operating room. We work in the recovery units, and we work in the intensive care unit. And some of us even work outside of those walls that I just talked about. And so that whole idea of changing that statement to anesthesia care in general hopefully opens up a more broad-based view of where our initiatives and focus is. That being said, we are a relatively small organization, and I think our effectiveness is teaming up with larger groups to try to make change. I was telling Desiree, for instance, we teamed up with the American Society of Anesthesiologists early on in this process to try to push higher level PPE, particularly N95 masks for folks that were doing intubations or aerosolized procedures. And because they agreed and we partnered with them, we were able to put out that guidance to the rest of the United States. And I think that has had a huge dramatic effect on hospitals trying to get the appropriate PPE for their providers. Whereas before that time, folks were intubating with regular masks or sometimes no masks at all. Those are circumstances where, given our resources, we need to partner with larger groups, larger governing bodies to make those types of changes. But I think from our perspective, if we can get ourselves involved with good research, safety science research, and provide good educational articles that really touch on key safety issues, we might be able to better inform our community that reads the newsletter. One of the things about our newsletter that I don't know if you know anything about our rapid response section, but this is something that really a lot of folks like in our community. And that is folks write in about a technological problem. For instance, recently read an article that we're going to reach out to the company about, where an operating room table broke and you pressed one button and you wanted it to go down, but it went up. And you can imagine the danger that can occur if somebody is undergoing laparoscopic surgeries. So our organization does is reach out to the industry members who provide that technology and partnership with them to try to solve the issues. We've done that with medication labels. One of the medication label companies was labeling only one side of a syringe of phenylephrine, and there was a drug swap. So we partnered with them to help them say, hey, we can do this better. We can suggest that you might want to do this circumferentially to reduce the risk of an unnecessary accidental error. So through our newsletter, we've actually been able to try to make safety change, and partner with industry to make those changes. And the community members. So I think the value, that's just something that doesn't require any high-level technology. Lots of times, it really requires discussions between all the members that are involved, and ideas on how we can improve the technology that we're using.
Yeah. Now, Stephen, you mentioned the educational component and then outreach, delivering your message through APSF. Have you collaborated with any of the educational organizations, the different universities, residency programs, teaching facilities and things like that here in the U.S.?
So we offer a variety of research grants that we put out yearly for safety scientists to get involved with. We have multidisciplinary, multi-professional safety research grants that we try to get, particularly nurse anesthetist students, residents, anesthesia residents involved with, so that at an earlier part of their career, they can understand the value and maybe make a change in terms of improving safety. So I think one thing is we provide those grants, and they're announced at our national meetings yearly in terms of what these folks have done. And we also allow them to write a little article in the APSF newsletter to get their information and what they're actually looking into to the broader audience. So that's one way we partner with local individuals at individual universities. We've had, as it goes to COVID, if you look at our website, we recently have posted 11 or 12 different institutions practice patterns, including my own institution, on how we're attacking the preoperative and perioperative testing issue. And so I don't know any other organizations who are doing that. We have about 11 or 12 algorithms from major academic institutions, private practices, as well as affiliates. And that provides our constituency and the broad audience with some ideas of how people are really doing this in the community and in a larger forum, such as a major academic institution. So those are some ideas of how we're trying to get our message across. I think the other thing that we're really doing, and I think this really reaches out to a lot of the trainees, is our huge increase in our social media audience. It has gone up, hundreds and hundreds of percentiles in the last few years, and particularly in the last 4 or 5 months with the COVID pandemic. So I think you have to know your audience. The audience has changed dramatically in the last 3 years, particularly with how people are learning. We kind of discussed that. Things like online podcasts and social media connections and, your website being interactive. We're trying to develop our website to be a hub for patient safety. So if you go on our website, you'll see a lot of links to other safety organizations and governing bodies so that you can come to our website and not have to go to every single one and try to figure out the information. We're trying to collect all that safety information and put it in one area so it's easy for people to access.
That's great.
So I think, there's a lot of different ways to do this in terms of partnership, and we're trying to do a little of everything, so to speak.
Tell us a little bit about what the APSF, you have mentioned it already, some of the things that you've been doing during the COVID crisis, but what are some of the other things that we should look out for?
I think really what put us on the map is our perioperative considerations for COVID-19 article that was really put out in February, really about a month before the United States shut most of the things down that we're doing. And so with that article, we just recently updated it, and the article focuses on appropriate PPE and safety, but also perioperative testing and what that might look like according to the CDC and the ASA and other organizations. In addition, we have an anesthesia frequently asked questions component to our website that really focuses on how to mobilize anesthesia machines, how to keep the anesthesia machines from being contaminated, and also how to decontaminate masks and other PPE. There is a large amount of questions from community members are answered by experts in our field and in our organization. The amount of viewers on that site alone has really escalated over 100,000, both national and international folks. So I think if you look at our letters, we are an organization that allows folks to write in on community issues. We have articles on how people are dealing with endoscopy and COVID. We have all sorts of interesting ideas that are shared on our website regarding safety, such as the hoods and so many other things. So if you go to our COVID Resource Center, a substantial amount of information. And then we'll also have links to governing organizations such as the CDC, the ASA, the AANA, so that you can know what is going on in your national organizations.
Can you tell people if they're interested and want more information, the websites and maybe some social media where they can find all that?
Yes, so you can go to www.apsf.org. Right on the top, you'll see you can click on the COVID Resource Center and you can get a lot of information. You'll also be able to access our newsletter. And if you wish to write an article on patient safety, the guide to the authors is on that tab. So we welcome any safety articles. We'll review them. We are moving more towards an editorial manager type author submission in the next few months, but we really welcome local, community, national, and international providers to submit their safety concerns to us. We are on Twitter, we are on LinkedIn and Facebook, so I'm happy to provide those at some point too, but you can see us, you just look at up APSF, and we have sites and we're involved with social media as well.
And see, if I may, Steve, we'll put a link in, just a bit of self-promotion here, to the article that myself and Mike Grocott wrote a few years ago. The reason I'm suggesting I want to point people at that is it's been really pertinent in COVID-19, because the question of, how do you want your patient today, sir, run too dry or too wet, says, well, what about just right? So it's an article about moderation, of which the original one was written tragically in 1967. So it takes us that long to cop on.
I greatly appreciated that, Monty, because quite frankly, a lot of folks in the United States are drying these patients out substantially. And a little too dry, as you know, it can affect the other organs that are so important to the vitality of these patients. So, just right. And how we achieve that is the big question. Thank you very much.
Yeah.
Thank you.
Well, Stephen, thank you so much for taking the time out to talk with us on Top Med Talk. We greatly appreciate it. Fantastic conversation. Thank you very much.
You too, and be well and stay safe, folks.
You too. Well, thanks for listening today. For more information, you can find all of the things that Stephen talked about in the show notes. It'll all be there for you.
Top Med Talk. Thanks for downloading Top Med Talk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, Top Med Talk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.